But let me preface her comments with this. Our situation is dire. This is a community call to action, to do everything in our power to slow the spread and protect ourselves and our loved ones and our neighbors. COVID-19 cases are spiking upward because of community spread, things that are under our control. We must take action to save lives and protect our families and neighbors. Now I'd like to turn things over to Dr. Mysheika Roberts for an update on the statistics, where we're at, and what the trends look like over the last couple of weeks. Dr. Roberts?
Sure. Well, good morning, everyone, and thank you, Mayor Ginther. We are now over 4 months into the fight against COVID-19, and I don't need to tell any of you that these are trying times. We appreciate all of you who are helping us combat this war against this virus by staying home, wearing a face mask, and washing your hands. But our collective efforts have not been enough to stop the spread of this highly contagious disease. We are now at a very critical point in our war against COVID-19, which continues to spread and increase in our community. As you may have heard, Columbus was recently placed among 11 cities urged by the White House Coronavirus Task Force to take aggressive steps to combat the spread of COVID-19. In fact, Dr. Deborah Birx, who leads the White House Coronavirus Task Force, was in town on Saturday, meeting with the governor and many local health officials in cities like Cleveland and Columbus that she placed on this 11 cities to watch. And Franklin County continues to have really high numbers. Since the alerting system came out by the governor, Franklin County has been listed as a red county, or level 3, for the health advisory system, and for good reason. Our cases have continued to climb. As of yesterday, here in Columbus, we have 12,379 cases, and unfortunately, we've lost 368 individuals from this virus. In July, we had 12 days with over 200 positive cases reported to Columbus Health Department. 200 a day, 12 days. And on July 11th, we hit our single highest day with 280 new cases reported to Columbus Public Health. Just to put a number out there for you to understand, when we look to see how our cases increased from June 1, which is about when we started to fully reopen Ohio, to mid-July, our case count increased 220%. That's a lot of illness, that's a lot of cases, and that should make all of us very concerned. Our highest number of cases continues to be in the age groups between 20 and 29 years of age. That also concerns me. Many of these individuals are asymptomatic, so they're not displaying any symptoms, or they have very mild symptoms. Thus, they might take the disease more casually than others, but then they could also spread it to our more vulnerable population, whether that's our elderly population or those who have an immunocompromised immune system that will make them more susceptible to some of the challenges dealing with this virus. And African Americans continue to be disproportionately affected by this virus as well. They make up 29% of our population here in Columbus, but they represent 31% of our cases of COVID-19. So the numbers are clear. We must use every tool that we have at our disposal to prevent the spread of this disease. Those who are ill or who have been exposed should get tested. Columbus Public Health continues to offer testing right at our health department in partnership with our 3 adult hospital systems, Mount Carmel Health System, Ohio Health, and OSU Wexner Medical Center. We're proud of that partnership. Since June 9th, we have tested 6,687 people at Columbus Public Health in partnership with our hospitals. And we have gotten very, very close to reaching that goal that Mayor Ginther and I set of testing 2,500 people a day. And the last week's data, we were just 50 people short from reaching that goal. So again, I'm proud of the work that we've done. I'm proud of the systems we put in place, but there's more that we need to do. Case investigation and contact tracing is also very important. If you are diagnosed with COVID-19, it's important that you pick up the phone when Columbus Public Health calls you. The information you can share with us is vital in helping us reduce the spread in our community. We'd like to know potentially where you work, other people you might have exposed, and your contacts, so we can reach out to them on your behalf and give them very specific guidance of what they can do to reduce the chances of themselves becoming cases and even potentially reduce the chance of them spreading it to other people in their household or their close contacts. So please, if you get a call from Columbus Public Health, pick up the phone and feel free to give us a call back after we leave that message. And of course, our prevention efforts that we should all practice. Everyone in our community should be practicing to keep everyone healthy and safe. First, stay 6 feet away. Second, wear a mask when you're out in public. Third, wash your hands. Fourth, it is so important, if you are sick, stay home. Avoid contact with others, and also limit your interaction with people in your household. And last but certainly not least, please do not gather in large crowds, even among your friends and families. Don't have that backyard barbecue with 20 of your favorite friends or neighbors. Really, we need to keep our large gatherings to 10 people or less, and whenever possible, we need to be wearing a mask, even in those settings. But we can't stop with just those items. We know we need to do more, and it's time that we do more to limit the community spread of this virus right here in Columbus. So now I'd like to turn it back over to Mayor Andy Ginther to discuss some new efforts that we will do here to help us with this fight with this virus. Mayor Ginther.
Thank you, Dr. Roberts, for your continued leadership and advocacy on behalf of public health in our community. We are very fortunate to have somebody with your experience, vision, and skill set guiding us during this crisis. As Dr. Roberts mentioned, our goals early on in battling this virus were built around access to robust community testing, having an extensive contact tracing and investigation network that she and her team have put together, and continuing to practice social distancing. But clearly, based on the evidence Dr. Roberts has just shared, that has not been enough, and we must take additional steps to slow the spread here in our community, and for each and every one of us to take personal responsibility for protecting ourselves, our neighbors, our families in this community. In order to slow the spread of this deadly infection, we must take action now, additional action. Legislation heading to council tonight to close bars, restaurants, and nightclubs at 10 p.m. beginning tomorrow, amended from the original legislation we sent on Friday. Based on the consultation with Dr. Birx that Dr. Roberts and the governor had this weekend, the fact that we know that we don't want to appear on future lists from the federal government as those being watched, we knew that closing bars altogether, as some have recommended, we thought was too far. But we know that there's a huge difference between compliance with social distancing and facial coverings, as our public health expert teams that are visiting these places see at 8 p.m. versus 10 p.m. And we know that it's critically important for us to take these tough additional steps to do everything we can to slow the spread in our community. By closing them at 10 p.m., we limit the amount of time people can be together at tables, at bars without masks. And as I mentioned, when compliance is generally good at 8 p.m., what our public health teams have seen is it's not very good at 10 p.m. The spread is much greater among ages 20 to 39, who also happen to be the folks most likely to be at bars after 10 p.m. As with the mask mandate, Columbus Public Health will handle enforcement with education first, then fines, and if violations continue, businesses could be forced to close. We will continue to watch the numbers over the coming days and weeks, and we'll take more action if necessary. Now, I know most of the press and the conversation in the community has been around bar and restaurant closures, but as Dr. Roberts shared in her comments, the other place that we know we're seeing statewide and in our local community are these larger gatherings at private residences. We know that the state health order limits gatherings at public places and otherwise to 10 or fewer. What I'm asking each and every one of our neighbors is to heed that same advice at your private residence. I know we're tired. I know we're fatigued. I know we're frustrated. And just in our house last week, my daughter celebrated her 10th birthday. Generally, we would have a family dinner or a barbecue with grandparents and uncles and nieces and cousins coming over to the house to celebrate. We had to do that via Zoom. She was disappointed, sad, frustrated. But that's what we need to do to protect each other and our loved ones. My nephew was going to celebrate his graduation party this weekend, but knew that he had to protect his grandparents, his aunts, his uncles, and other friends who might have chronic health conditions. And so he canceled that. I know these are tough choices and hard things to do, but I'm asking each and every one of our neighbors to take personal responsibility with gatherings at their homes. We each have a role to play in the coming weeks. Early evidence is that masks mandates are helping. We have to continue to maintain social distancing and wash our hands. Columbus, we have an opportunity. The power is in our hands to do better for one another and for our neighbors. Now I'd like to open up the floor for questions. Please come to the podium in chambers one at a time. Dr. Roberts and I will be able to see and hear you, and we'll answer your questions as you come.
Good morning, Mayor. Kevin Landers, WBNS 10 TV. How close were you to closing bars permanently? And explain the science behind closing at 10 p.m. versus 7 or 8 o'clock so people can understand where you're coming from. Thank you.
Kevin, for the question, it's a great question. I'll let the public health expert speak to the science. I don't think you want this political scientist speaking to the science. I'll let her speak to that. But it's something we considered. Dr. Birx actually recommended it actually as a consideration statewide. There are other communities on this watch list, Kevin, that have taken that action. I know Mayor Hogshead over in Indianapolis has taken that action. I think closed them until August 5th. And it's something we seriously considered based on what our public health teams were seeing out there and knowing that it is very, very difficult to practice social distancing and have facial coverings and masks on in bar settings. And what our public health team saw is a great deal of compliance earlier in the evening and very poor compliance later in the evening. And so trying to balance all these things out, wanting us to be, remain open, but taking additional steps to protect the people of Columbus, the employees that work in these establishments and those that frequent them, and also seeing the numbers in the spike of particularly 20 to 39-year-olds and who the public health teams were interacting with in these places. But the threat is real. I think there was one instance where through contact tracing and investigations, I think we were able to trace back, was it 12 or 15 individuals? 13 individuals from one gathering at a bar in Central Ohio. And so this is real, and we need to take action collectively as a community and personally for responsibility for this. But Dr. Roberts, you want to speak a little bit to the science?
Sure, happy to. So in terms of the science of this, one is the evidence we have, and as Mayor Ginther mentioned, our team, when they go out to do these compliance checks, we see a change in behavior really starting around 10 o'clock, and it gets worse as the evening goes on. Making or asking restaurants to close any earlier than that, we really don't have non-compliance data to support that locally. And also when we talk to our peers across the country and our federal partners, 10 o'clock seems like a reasonable hour. People can still have dinner where they're sitting down with their small group, but we're really trying to avoid that crowding, that congregating that tends to happen later in the evening. And we know that is where a lot of the virus is easily spread, when we're congregating in those groups, close quarters, without wearing a mask, consuming beverages.
Mayor Ginther, Dan Perlman with NBC4. I've been in touch with the Ohio Restaurant Association, and I understand they sent a letter to you this weekend. They say they would like you to reconsider your proposal as it pertains to their industry and meet with a group of restaurant leaders to discuss best practices, just like they did with the state. Have you discussed this with any industry experts, or would you consider doing so before council votes on this tonight?
I appreciate the question, Dan, and I know our staff and staff at Public Health and the Mayor's Office staff have been in contact. I had messages and phone calls over the weekend from folks in the business, so I have heard them out and wanted to make sure that some of the calls and concerns that came from restaurant leaders was about closure, restriction of drive-through delivery or pickup after 10 p.m. And obviously this legislation will exempt folks that are going through drive-throughs, doing pickup or having delivery. We're really trying to focus on the greatest threat, the greatest risk, and that is folks in close proximity for extended periods of time indoors who aren't able to practice social distancing and having facial coverings. But my door remains open. I talked with folks over the weekend. I know my staff, and I'm sure Dr. Roberts and her team talked with folks from the industry, and be happy to meet with them to talk more about their concerns. But we're taking action, and this is something that the council president and I and members of City Council believe very strongly in. We believe that after meeting with Dr. Birx this weekend and hearing her out, Dr. Roberts and her team feel very strongly that 10 p.m., based on what they're seeing in bars and restaurants across the community, makes the most sense, and we can have the greatest public health benefit by having them close at 10 p.m. But my door remains open, and we'll continue to listen to folks from across the community, but the time to act is now, and we believe, based on the advice from public health experts, that this is the best course.
Mayor Ginther and Dr. Roberts, it's Mike McCarthy with ABC6. Just a follow-up question to what you just said, Mr. Mayor. I haven't had a chance to look at the legislation just yet. It was just sent to me, but you had mentioned, and I just want to clarify, drive-through and delivery service would be able to be extended past 10 p.m. And then also, I was curious as to, has there been any discussion what the criteria or what the data points would have to be to rescind this to get rid of the 10 o'clock if it does pass council tonight? I know that's like way down the road, but I was just curious what the thinking is on what it would take to get this lifted in the city if it is in fact passed tonight.
Both great questions. To the first question, yes, folks will be able to continue to go through drive-through, do carry out, or have food delivered past 10 p.m. This is, again, going after folks in close proximity who aren't able to practice social distancing and not wearing facial coverings or masks for extended periods of time. So to the first part of your question, yes. To the second part of the question, obviously we're going to listen to our public health experts, and based on what we've seen in the increase in cases and the threat to our health systems with them being overwhelmed based on the increase in cases, we're going to listen to them and follow their lead. I don't think I have any predetermined a date or number of cases where I would ask council to rescind this or go in a different direction, but we have been red and nearly purple, but red ever since the state system went into place. And Dr. Roberts and I and other public health leaders in this community believe we must be doing everything in our power to get off of that red category. And so, this is an additional step into all the other things that both the governor and that we've done locally to try to slow down the spread, which we know at this point is driven by community spread, and that's what we're focused on. Dr. Roberts, do you have any initial thoughts?
No, I would just add, we don't have any one indicator that we're going to be looking at. I update the mayor regularly on what our data looks like. One of the things we look at is not only the number of new cases, we look at the positivity rate, and we also look at our hospital capacity. So keeping all of those things in mind, we will make a decision on when we think it is safe to resume normal operations for our restaurants and bars.
I do want to reinforce to the community, though, the importance of getting tested. There's a number 645
1519.
645 1519. They can go to the city's website. They can text to get information about getting tested. Dr. Roberts and her team have put together an incredibly robust and effective community testing effort for communities, for neighborhoods throughout the city with our federally qualified health clinics, FQHC lookalikes, our health systems, all working together to make sure that we're making testing available and accessible to everybody in the community, and that remains an important part of our comprehensive strategy to slow the spread. Because we know that there are many folks that are positive that do not have symptoms, but if they know they're positive, they can take actions and protect themselves and their family and loved ones from the spread of COVID-19, and so that remains a critical part in addition to the contact tracing and the investigations that Dr. Roberts and her team are leading.
Mayor Ginther, Dr. Roberts, Danielle Grossman, NBC4. So I have a question. It isn't about what's going to be discussed tonight, but about temporary patio expansions. So I know a lot of restaurants and bars have been asking for these temporary patio expansions. Right now the city, the health department isn't allowing it. What is your response to that? Is this something that's being discussed to maybe visit in the future if cases do go down? I know a lot of other cities in the state are doing this successfully. Franklin County also is allowing this in places like Dublin and all of those areas as well. So I guess, how are you approaching this? I know it's something to help get people outside, have them social distance, and that's the argument that these business owners are giving.
There are folks that are asking these questions, and while we're trying to reduce the size of groups and length of times for people to gather, quite honestly, we're trying to do that whether that's outside or inside. Making exceptions for additional outdoor seating does not make sense in the midst of a pandemic. We haven't expedited that process, but we haven't also turned it down or stopped it. We're using the process that we have always used. So we're not, however, slowing down the permanent expansions of outdoor dining. Those applications are being held to the same standards they were before the pandemic. Our thought is, if outdoor dining made sense before the pandemic, it may make sense now. But for us to expedite or to change that process to encourage more large gatherings for folks for extended periods of time, whether it be inside or outside, just didn't make sense based on the science and the evidence. We know that outside is better, but we also know that large groups of folks gathering for extended periods of time where they may or may not be able to practice social distancing and wear facial coverings, we know is a risk to contributing to the spread. Any additional comments from a science perspective, Dr. Roberts?
No, Mayor Ginther, you said it exactly. I mean, just trying to avoid that congregating of individuals outside, and we do recognize that other municipalities have done this and considered this, but I would remind everyone that Franklin County, and particularly the city of Columbus, leads the state in the number of cases, and so our approach might be different and needs to be different than some of our sister cities.
Hi, Mayor and Dr. Roberts. Mark Ferenchik with the Dispatch. A couple weeks ago at Milo Groveland, there was some discussion about block party permits. Can you tell me how, or tell all of us how that might be affected by your discussions today? And also, have there been discussions about closing or limiting hours for other retailers beyond bars and restaurants?
I'll have to get back to you with respect to the block parties, Mark. Obviously, based on what we shared a couple of weeks ago and what we know today, things have changed. Quite honestly, I think Dr. Roberts and I would not have considered before the spike in the trend that we're seeing during the month of July, restricting bars and restaurants and having them close at 10 p.m. just a few weeks ago. But clearly, the numbers and the evidence demand that we do more, and that's part of why we're taking action now. So I'll be happy to follow up or have our office follow up with you regarding permits for block parties, clearly based on what we know today versus a couple weeks ago. If those happen, they have to happen very differently than what was thought about a few weeks ago. Then the second question.
Other restrictions that we would...
Other restrictions that we would consider, specifically on retail. Based on the evidence in research and science, and I'll let Dr. Roberts speak to this, retail is one of the lower risk areas of commerce for spread. Obviously, having the mask mandate, in our community and now statewide, having business owners, shop owners enforcing that and requiring that, having folks do hand sanitizing, limiting the number of folks in retail establishments, all the things that are already being done. We haven't necessarily contemplated that, but Dr. Roberts, I don't know if you have any thoughts around retail.
Sure. So retail is not as concerning to us as bars and restaurants, and it's for obvious reasons, as the mayor alluded to. We have a mask order now in place for the city of Columbus that people are required to wear masks. There are a few exemptions for that. Obviously, there's some medical exemptions, there's age exemptions, but you do not have to wear a mask. It's actually impossible to wear a mask while you're eating or drinking, and so that's a risk. We know that when you are eating or drinking in a restaurant, whether you're inside or outside, and you're not masked, you are a risk not only to the people at your table, but even the staff may be coming to serve you at that time. So that is something that we took into consideration when I gave recommendations to the mayor to consider. Retail, obviously, you're wearing a mask, or you should be wearing a mask the whole time you're in the establishment, and so you are protecting yourselves, others around you are protecting you as well as protecting themselves. So I don't see retail as a next step of another recommendation to try to control the spread of this virus. There are others that we would consider, but retail is not something that I would be focused on at this time. And in terms of your block party question, I have been in touch with Director Rakowski from Rec and Parks, and we talked about that decision shortly after we made the mask order, that we probably needed to restrict the block party activities because of the increasing activities in our community. So to the best of my knowledge, those activities have been put on hold, but I can verify that.
Ted Hart from NBC4. Dr. Roberts, a couple of questions about testing and contact tracing. It's been reported that there are some national shortages with regard to the reagent. We've heard about long delays, as much as 2 weeks, in terms of getting test results back. I know that can vary from a day to 10 days to 2 weeks. I guess, to what extent have the delays in actually processing tests and or the shortages of reagents affected testing here in Columbus? That's one. And the other question has to do with contact tracing. When you're having 200 more or more, 280 new cases in a day in Columbus, it would seem that that's very difficult then for your contact tracing staff to keep up with that.
Thank you. So in terms of the lab shortages or lab delays, we've seen some of that here. Most of those have been with our private labs. Our hospital system, so all 4 of our hospital systems have a very quick turnaround when they are running tests. And I will say that our 4 hospital systems are where the majority of our tests are coming from here in Franklin County. Obviously, we have partners with CVS, and they're doing some testing. Some of our FQHCs are doing testing, and they're sending that to private labs like LabCorp and Quest, and they have noticed some delays. I've only heard a handful of cases here locally that have had a 2-week delay. Most are getting the results back in 5 to 7 days when they're going through those private labs. Again, our hospitals are turning these results around anywhere in 24 hours to maybe 72 hours. We're getting the results back from our hospitals. So we haven't seen that so much in terms of the delay. Now, I think many of you know last week we did have to make a change at the front circle at Columbus Public Health in our testing. We had to refer our asymptomatic residents to our FQHCs and private labs like CVS to get tested because our hospitals were experiencing some shortages in their lab supplies, and we really wanted to keep our hospital testing for the sick who need those answers as quickly as possible. And so we did make that adjustment last week for testing at Columbus Public Health. Again, if you're asymptomatic, you can still get tested. You can call us at 645-1519, and we will assist you in getting you tested. We just can't test you at Columbus Public Health at this time. As far as contact tracing and case investigation, yes, with our numbers doubling in some cases, we have had to bring on more staff to assist. And so in the last few weeks, we brought some outside staff, but we've also taken really some of our internal staff and deployed them and had them do this work. So in the last 10 days, we brought on an additional 60 staff that are already our staff. We've just asked them to do a different function within the health department to assist us with our case and contact investigation.
There are 2 points I would add to your questions, Ted. First of all, you know, we think it's critically important to continue to get information out there to the community about getting tested so that they can make sure they protect themselves and their families. You know, one of the things, though, with respect to supplies and kits, Governor DeWine has been very helpful. We asked for his help a few weeks ago, and he was successful in helping us get additional reagent for one of our health systems. Dr. Burks committed to Dr. Roberts this weekend to help with some of our supply needs and testing kits and reagent needs, as well as the governor. So I know they both have committed and are working with Dr. Roberts and her team to bring those to bear. You spoke directly to a point in the significance of CARES dollars, because we wouldn't be able to do any of the things that we're doing now around contact tracing, investigations, one of the most robust community testing efforts, I would argue, in the Midwest, but certainly in the state of Ohio, without CARES dollars. So, you know, I don't want this opportunity to go by without saying thank you to Senator Rob Portman, thank you to Senator Sherrod Brown, Congresswoman Joyce Beatty, because those CARES dollars that they help support and get to Columbus are being put to use every day in fighting COVID-19 in this community. So just wanted to thank them for that. But both Dr. Burks and Governor DeWine are working hard with Dr. Roberts and her team to get more access to testing kits, supplies, and reagent.
Kevin Landers, WBNS 10 TV. Mayor, do you believe it's safe for children in Columbus City schools to return when they start up in the fall? And in terms of Dr. Roberts, in terms of the number of cases, are we seeing more cases because we're testing more?
It's a great question, and it's something that Dr. Dixon, President Adair, Dr. Roberts and I have talked about several times. We continue to discuss you know, what reopening Columbus City schools looks like. One of the reasons, again, with CARES dollars, due to help from our federal partners, that we were able to make sure that every Columbus City school student had a device when school resumed this year, whether it's in person or virtually, was to go after that disparity, the inequity of only some students having them, or in some cases, one device per household. Some of them, because of the Wi-Fi and lack of access to internet, high-speed internet in different parts of the community, we thought that investment made a lot of sense as part of our larger equity agenda and those students' needs right now. So we're continuing to work with Dr. Dixon. Dr. Dixon and President Adair are looking to Dr. Roberts, our public health leader in this community, for guidance, and we're going to continue to meet and talk with them about that. Obviously, they're concerned. Dr. Roberts is concerned about the growth in cases over the last several weeks. And, if this continues over the next several weeks, there are going to be some very difficult decisions that need to be made. Dr. Roberts, you want to try to tackle the second question?
Sure. Just to chime in on the schools, I have given the schools some guidance that my recommendation is that we wait to bring kids back to the classroom until we have 4 consecutive weeks of a downward trend in cases. I want to make sure the kids go back, but I want them to be healthy and safe, as well as the teachers and the staff who have to support them. So I have made that recommendation to Dr. Dixon and her team. Regarding your second question, which had to do with do we have more cases because we're doing more testing, we get asked that question a lot, and a data point that we look to is our positivity rate. And the positivity rate helps us determine really how many cases we have, regardless of how much testing we are doing. And our positivity rate has increased tremendously since June 1. When we were at the stay-at-home order, I believe our positivity rate was around 6-7%, and since that time our positivity rate has gotten as high as almost 13%. And that number again factors in the number of tests you're doing, whether they're positive or negative, and then the number of positive cases you have. So we do believe this is real virus transmission, this is community spread, this is not an artifact of just us doing increased testing here in Franklin County.
I think we have time for one more question. No more questions? All right. Well, thank you everybody for joining us, and thank you, Dr. Roberts.
Thank you.
Have a good day.
A call to action by Columbus Mayor Andrew Ginther after a spike in COVID-19 cases in the city. Ginther says he will ask City Council to vote to close bars, restaurants, and nightclubs at 10 p.m. starting tomorrow night. Council will vote tonight. Columbus Public Health will enforce, first with education, then with fines. Ginther said the other place where COVID-19 is spreading is large gatherings at private residences, and he's asking city residents to cancel those. The mayor said more action will be taken if the COVID-19 numbers continue to rise in our city. He said if violations continue, businesses could be forced to close. Mysheika Roberts, the doctor of the city health department chairperson, said most of the new cases are in the 20 to 29 year age group. And then at the very end, she said something very interesting. She said she would recommend that schools not reopen unless the COVID-19 rate is on the downswing for several weeks. Stay with us here on ABC 6. We'll have complete coverage coming your way on ABC 6 News today at noon. We'll see you then.